Legal advice, because there's always small print. We must remind you that the health advice given on this show is general advice, and that for any specific condition you must seek the help and guidance of your doctor or a professional medical advisor before commencing any treatment or any kind of dietary regime. And welcome to ExpatLive.TV, we're the health show again. And we have our panel of experts.
Hi, I'm Leonie, Amond, kinesiologist and aromatherapy masseuse.
Hi, I'm Liz Nagle, naturopath and thermographer.
I'm Jeremy Kenton, an osteopath.
Kate Moss, yoga teacher.
Juliette, Noske, yoga teacher, life coach and neurolinguistic programmer.
And today's show is about back care, caring for your back, prevention, what are the causes and what we can do to help. So you're going to question me, I think, today, as an osteopath. So fire away. If I begin actually by saying that what we should look at is the causes of back pain, and there are so many different causes, from the simple musculoskeletal, and behind us we have a long list of all the potential problems that can be causing your back pain. It can range from vascular problems in your blood vessels, it can be inflammatory, infectious, all kinds of issues, idiopathic of unknown origin. It can be from congenital problems that you were born with. It can be trauma from a fall or an accident causing damage, disc damage. We can have problems which are to do with psychological problems, that classic thing of something being a pain in the neck, emotional problems, endocrinal problems such as osteoporosis or back pain following the menopause, degenerative such as the wear and tear as things wear out and we begin to fall apart, destructive from bone infections such as TB. The list is endless, and there are so many causes, and it's very easy sometimes to think it's a simple problem when it's actually more complicated, but it can also be the other way around in that it looks complicated but it's actually very simple, and the way we use ourselves has a huge bearing on it, doesn't it?
It does indeed, yes. So one of the things that I'm really interested in relation to the back is the awareness that we have. So, for example, imagine you're there standing doing the dishes. You might be standing in the wrong position, and if you're not conscious of that, you can actually be doing more damage just slowly over time every time you do the dishes. You know, if the sink is too high or the sink is too low. And when I ran marathons, they put you on a machine to test how equal your feet are, how your legs are and everything, and how you're running if you're running correctly. But I've learned that you can actually do that on your own if you start to be conscious about how you're standing, you know, how you're sitting. We often sit relaxed, but if you just sit up a little straighter, you can work on your core muscles using those to sit up straight.
Well, the strength of our body is dependent upon our abdominal musculature as well as the spine, but the way we use ourselves, that use affecting the way that we function, and for massage that has a huge bearing as well, doesn't it, in terms of the muscular system.
A lot of clients that I see come and they've got a lot of muscular tension causing them, they think, back problems, serious back problems, and as you say, it's usually muscular, not skeletal in that situation, and it could be from, as you say, poor posture at work. It could be that they've lifted something very heavy and not lifted it in the correct way. They should be bending from the knee and lifting heavy items close to the waist and to the chest, not bending over from the waist and lifting heavy items. You put a lot of strain on your back that way. And, you know, carrying heavy bags on one shoulder, for instance.
Even carrying weight.
And mothers carrying babies on one hip or the other.
Classic problem.
Shopping, you know, women, it's quite often women that I think do suffer from that, or people who work in labour, you know, construction labour. You get a lot of people who are using heavy machinery or lifting heavy things, and they're not fit, you know, they're not necessarily looking after themselves. They might be overweight, the muscles might not be strong, the core muscles, as you say, might not be very strong, and they're working hard, you know, whether it's sort of over the shoulder, using...
Coleman.
it could be,
Yep.
or, you know, hammers, whatever it might
Santa
be.
Claus, common problem. Yeah, elves get it a lot.
Yeah.
Yeah.
When they come and see me for a massage, you know, I'll be doing deep tissue massage to find where the muscle tension is, and working all my way up the spine and down up the neck and down the arms, obviously into the hands. I mean, it's amazing just how far the tension carries around the body. And a lot of it can be just emotional stress causing muscular tension. So a good aromatherapy massage is fantastic to relax. You know, you're inhaling all these wonderful relaxing aromas like lavender or lemongrass, and having a good deep tissue massage just helps to relax everything. People that come in with back pain quite often find that that's a really good way of immediately releasing tension and releasing some of the back pain that they're suffering from, which could be localized pain, muscular pain.
And as you say, occupation has a huge bearing on it. I mean, every occupation can potentially cause a problem, be it a taxi driver who's sitting all day long, somebody at a desk using a computer wrongly, if their computer screen is set to one side rather than being directly in front of them. All these things build up that pattern of problems and can produce pain. And pain is this massive problem. More hours are lost to British industry through back pain each year than through industrial action.
Well, in some countries now, they have new incentives in some of the bigger companies where seated massage is available for staff. So it's worth inquiring, if you work for a big corporation, whether that's available to you, or maybe asking the boss if they could start that incentive, because a masseuse can come in and do 15-20 minute seated massage for you halfway through the day, and that's part of your bonus or your perk package.
Yeah, when I lived in Japan, actually, they had a special scheme where you could go for discounted back and shoulder massages, and I took advantage of that a lot.
Which is very helpful.
Yeah.
An ergonomic assessment in the workplace, where they'll check to make sure your chair is correct, to make sure that you're seated correctly.
It's illegal now, isn't it?
It's compulsory.
The correct.
Yeah.
It is
Obligatory.
Thank you.
Obligatory. Good word.
They give you
Good
a
word.
chair under if your feet are too. If your legs are too short, they give you a chair, a stool to put your feet on.
Yeah, well, usually a sloping foot
Yeah.
support.
Yeah.
But
Or rest.
every
Talking about-
occupation,
Talking about feet, I mean, it's really important what shoes you wear, isn't it?
very important,
Yeah.
and we'll actually be talking about that in a moment. We have a little surprise for you. More of a surprise for the person we're going to use, but yes, we have a surprise. But the other aspect is for you, in terms of yoga. I mean, do you feel that yoga is of great benefit? I feel it is for back
it
care.
works on two folds. One is that you're strengthening the muscles, so you're strengthening your body, which is going to help. And then what you're doing is you're stretching out the body, so you're kind of releasing tension. You know, so I think for those two aspects, that's probably how it helps the most. I don't know if you have.
Well, a lot of some of the asanas, the postures are isometric, so they even out the sides of the body. So if you have someone who's has the mouse on their computer and they're always using that hand, for example, or when you're right-handed, it uses both sides of the body equally, and then so you're strengthening one side, then you're strengthening the other, so you're balancing out the body.
I mean, a simple thing, which is so easy, is when you watch somebody when they're using a mouse, is to make sure that they have a wrist support for the mouse.
Yeah.
And it takes all the strain off the neck, the shoulder, and the upper back. Just a simple thing, a little gel pad. Disc problems are another major factor, which for me as an osteopath, very important.
Well, I was going to say, can you tell us about some of your clients, perhaps? That you
Oh my
see?
God, my patients, I see so many of them. But here we have some very interesting things. These are donuts.
This is a health
Right,
show.
this is a health show.
This is a health show.
The disc acts as a shock absorber, and as you can see from that diagram behind me, the disc lays in between each vertebra. And if you imagine the disc is an outer protective fibrous coat with a thick gel inside, and if we cut this one, I should have prepared one earlier in true Blue Peter style, not a lot of jam, but the nucleus inside moves. So when you bend forward, the jam goes back. When you bend back, it oozes out the side. No, it doesn't. So what happens is that it acts as a hydraulic mechanism the gel will move forward. Now, as we get older, that compresses. So therefore that's putting more strain on that, which causes the jam, the nucleus, to bulge and to protrude out. And then what happens, and here we have one not prepared earlier, but if we squeeze it, the jam comes squeezing out the sides.
Nice.
And that's what's happened with the nucleus, and it causes that to bulge, and that pushes direct pressure on the nerve, producing either leg pain, or if it's in the neck, into the arm and the hands, and can produce tingling and pins and needles, and all those sensations that people experience. And
Very unpleasant.
Between two discs.
yeah.
Okay.
And is this why, as people get older, like my grandma, for example, they seem to shrink?
Well, there's that natural narrowing. There's a natural narrowing of the space between each vertebra as you get older.
Yeah.
And that whole wear and tear process. We wear out. We're a mechanical structure. And we're we're not even meant to be on two legs. We have not evolved at all from being a four-legged creature. And if you watch a cat or a dog, picture behind, and you watch it turn, it'll turn its head to the left and the whole body will curve. And that's the main movement our spine's designed to do, bend to the side. How often do we do that movement? We don't.
Unless you come to yoga.
Unless you come to yoga, right.
We do
But
our
in
side
normal
stretching.
daily
Sure, of
movement.
course.
So what happens is that because we don't use the main movements we're designed to do, we bend forward, we twist, as you said, we stand at the kitchen worktop, something's over here, instead of taking 2 steps along and picking it up, we bend, twist and stretch, and we wonder why we get the kind of problems that we get. So the whole way in which we use ourselves is incredibly important, frighteningly important.
So it's important to have a strong core. So doing something like yoga or Pilates will strengthen those muscles, I suppose, and help. So if you're doing that reach, at least sort of suck and hold in maybe.
Well, there's a,
I don't know.
there's
I
a
mean,
bit of
what are
controversy
the-
over that as well, in that if you look anatomically, if you build up the core musculature, the abdominal muscles, what happens is if you keep that level of exercise, that's great. But if you stop, and we all know what it's like, you join a gym in January and your membership in February isn't used that much, and by May you never go, and you let that then go, it's very difficult to bring that back, and it can cause even more problems than you may have had in the first place. So there's a lot of argument as to whether or not you should even work the core musculature, because if you don't keep that up, it will be the kiss of death for your spine. Surgery, you wanted to ask about that. Off air, we were talking about it.
Well, I mean, I'm very fortunate that I haven't really suffered from much back pain, but I know that there are lots of people who, I've met lots of people who have, and then I've had students that have come to yoga and they say, oh, the doctor's suggesting I have like surgery, and it seems quite, I mean, obviously, as you were saying earlier, in some cases it might be necessarily, but is that possible to prevent that? Like other I mean, is that the extreme, or?
Well, it depends on the cause, and we have to be realistic here that people using manual therapies, such as myself, osteopaths or chiropractors, physiotherapists, kinesiologists, masseurs, naturopaths, magnetic therapy, which we'll talk about, we can't help every problem, and it depends totally on what the cause of the problem is. For some problems, surgery is the only option. For example, there's something called the cauda equina syndrome, which is called the horse's tail, diagrams behind us, and if you look at that, it's the group of nerves that supply the bladder. Now, with certain spinal problems, spondylolisthesis, which is a forward shift of one vertebra on another, it entraps the cauda equina and it becomes an acute clinical emergency. If you don't operate within a matter of hours, the patient will get bladder paralysis and can even get leg paralysis. So that's an extreme case. Another classic one which will require surgery is extreme spinal curvature, S-shaped curvature, scoliosis. With some people, especially if you can get them young enough, you can do a lot without surgery, but there are times when surgery is essential, or to decompress a nerve where it's producing direct nerve pressure and producing constant, unremitting pain that cannot be relieved by any other
Or
source.
if you have a broken back, if you have an accident and break your back.
Spinal fracture, yep. There are times when it's necessary.
That they also, like, I don't know if you can explain a bit about when they cement the back?
Right, well there are so many different kinds of surgical techniques, ranging from injecting sclerosing agents, or putting internal fixation in using rods, pins, screws, plates, cage work. Totally depends on what the problem is as to what kind of surgery is going to be used. On the most simple level, what they'll do is they do what's called a fenestration. So they open up that space showing behind us where the nerves pass out from. So they'll literally chisel away. They're sort of a mixture of amateur carpenters and a bit of woodwork, a bit of metal work.
So for avoiding surgery,
Yes.
we wanted to come to you because osteopathy and chiropractic is a very good mechanical way of resolving back problems. Can you just explain to us a little bit what osteopathy is exactly for the viewers that
Right.
are familiar?
Well, what osteopaths and chiropractors do is using mechanical methods to actually move joints. Now, nothing's ever out of alignment. That's a bit of a myth. But what happens is that it's all about movement and the space between the joint. And what we're doing is we're increasing that space to take the load off a nerve, to reduce the pressure on that nerve, to reduce the pain. It's as simple as that.
Fear of coming to see a practitioner like yourselves because there'll be, you know, a speedy click-clack of the neck,
An
or
adjustment.
An adjustment, yes.
Yeah, moving the joint at force with speed so it makes a horrible noise. But it isn't painful.
Does that happen?
Oh, it happens every day. It's something that we as practitioners are doing to our patients, but it's not unpleasant. It shouldn't be done with force because it's technique. It's not about hurting. We're there to help you, not to make you worse.
Taken beyond the resistance?
Well, it is. We take it beyond its range of movement and that little bit more to open the joint space up. But the idea is to help the person, not to cripple them or maim them, and it is a very effective form of treatment, but it's not the be-all and end-all.
How many treatments would a client or patient usually need?
It depends on the problem, and that's what it's all about, establishing the cause. And you, as a naturopath as well, you'd agree with me that it's all about causation.
It's all about cause, yeah, because you just can't generalise.
No.
And, but you can relieve the pain, and certainly, you know, turmeric is a great anti-inflammatory, and black pepper essential oil rubbed in is another great anti-inflammatory. But in my practice, I use magnets a lot, and I'll just give a quick demonstration here. With my thumbs, because my spine is out of alignment at the moment for some reason. I know you don't like the word alignment, but there you go. So if I put my thumbs together like this, we can see...
There's a definite difference between the two thumbs.
Well, we can do it.
And this is level.
That's level.
That's level, but there's a shortening on that right side.
So can I, are we doing this now?
Yes, let's do it now.
You put the red side, the south-facing magnet on my right kidney. Okay, and you put the black north pole onto my left parietal bone there. Okay, that's it. And now I'll just line up my thumbs again. And...
Oh my God, they're equal.
Oops, sorry.
Oh, they're not now, but they were.
There we go.
And then tip them forward for the camera.
And tip them forward for the camera.
Just from a few seconds of using magnets.
Yeah. Now, if I leave them there, depending on how close or far away from the equator I am when I do that, I have to leave them for about 15 minutes to 30 minutes for that to correct.
Right.
And I'll tell you a quick story about this.
Let's talk about that story another time,
Okay,
because we have a very interesting experiment to do. Because we were talking about posture.
Yeah.
Fashion has a huge effect on producing back pain. If you think of people carrying shoulder bags, if you think of tight clothing, if you think of tight belts, but especially high heels. And here's a little experiment for us. I shall. Not me. Hello, Ben.
Hi, Jeremy.
Now, you've rather sort of keenly volunteered for something and you don't know what you've let yourself in for.
This is new to me, a new experience, but...
Right, well, we were talking about the way in which posture has an effect and causes back pain. And we were talking about how fashion has an effect, and especially these things, which are ridiculously high. Are you used to wearing high heels? Is it something you do?
No, it's not a hobby of mine. So.
Right, well, let's just have you standing up for me. with your back to the camera.
Okay.
And we're just going to have a little look to make sure that you're fairly straight. Shoulders a little bit uneven, this shoulder's higher, but your spine's fairly straight. Now, take a seat and put these on. This is going to be an interesting experience for you.
Okay.
And you're absolutely sure that you don't normally wander around in high heels?
Yeah, no, it's not a normal appearance for me.
You would not believe the problems we had trying to find a pair the size for him. And he's putting them on. You do look as if you're very comfortable putting these on. It does begin to worry me. But fashion has a huge effect, you know, and the way that people wander around wearing such ridiculously high heels, which aren't an everyday wear, they're something that people tend to wear more when they're going out for the night. But the shoes that we wear, the way that we stand, the way that we sit, all have an effect. And the effect's going to be quite remarkable for you.
I think I'm going to have a whole new appreciation for
the agonies of fashion. Right.
Okay.
How do your calf muscles feel?
A bit achy already.
A bit achy. Right, let's have you with your back to the camera again.
Okay.
Okay, you probably feel as if you're walking on stilts. But if you look at the calf muscles, they've now gone into this huge tensed up state. And also these muscles here, the erector spinae, holding you upright. Now, let's have you walking up and down for me.
I can try. Okay.
And if you look at how wonderfully balanced he is, he's throwing his whole body forward. Calf muscles tightening up. Keep walking, go on, 3 or 4 times. Bending from side to side to try and keep his posture upright. To the point where he can hardly stand up. And here I've got a little surprise for you. Just to add to this, we're going to put this on your shoulder.
Okay.
It always amazes me the stuff that people keep in their bags. And as you can see, his balance is absolutely awful. Now, for the average woman who's used to wearing these, they adapt and they compensate. But you are showing how difficult it actually is to walk. And really, that's all that can be said if he doesn't break the heels off. Right, with your back to us again. And he can't even stand up. Really, that says it all, the effects of fashion on posture and creating back pain. Thanks so much, Ben. Thank you. So fashion, not actually a good idea. Unlucky to put new shoes on the table. It's meant to be only for undertakers, but never mind.
I wanted to try it on to see who it fits.
Not for me, no, no.
Well, thank you very much, Ben. I think that was
Very
very kind.
well done, thank you, Ben. Very brave of him to do that. But he did look as if he was doing it a bit too familiar, very familiar with the experience,
I think. Make sure those very expensive designer shoes don't disappear off the set later.
Yeah. So other causes of back pain which can be prevented, we've talked about the simpler things, those musculoskeletal simple issues, but then there are the various conditions which are actually disease processes, such as bone infection or osteoporosis, where you cannot reverse them. Nobody can reverse them, but there's a lot that can be done to actually help alleviate the pain, improve their posture, improve their lifestyle, so that they can make changes. So with the naturopathic side, there's an awful lot that can be done with hydrotherapy, isn't there?
Hydrotherapy, obviously, which is just a fancy name for water therapies, and you know, things like Epsom salts baths, just for relaxing the muscles and just allowing them that gap in to come back into the structure of the spine.
Yeah. And increase the donut size.
Increase, yes. Just not squash them down so much. Epsom salt is just a magnesium salt. You can't get Epsom salts everywhere. I kind of realised that when I moved to Spain.
It's true,
so it's just a magnesium salt. And taking magnesium supplements is really important. People are very deficient in magnesium these days. So magnesium is really, really important for relaxing stress and tension, and it's also really important for the absorption of calcium to keep your bones strong. So you need calcium and magnesium. That's why most people take a CalMag supplement.
I actually read that magnesium needs to be taken through the skin. I don't know a lot about it, but I actually read an article that said it's best to be taken through the skin if you...
I think it's probably best to take it through the skin, but you can take it sublingually as well.
Okay,
and the best way to take it really is in your food.
Yeah.
But, I think food is your medicine, really.
Sorry to interrupt you. I was just going to say, with the trace elements I work with, and so with kinesiology you can test and see which trace elements you're actually depleted in or have an imbalance in, and magnesium and selenium actually is quite a good one for women that are going through the menopause, and to take as well.
And just to mention that, talking about different things that we might take herbal wise, it's also very important to, consult your doctor, especially if you're on other medications, because I was taking two different things basically. I can't remember what they were. One was maybe horse chestnut, and one was something else to do with menstruation. And when I actually read up about them, I read that you're not supposed to take them together. So even though we're taking these herbal things, herbal tablets, we do actually still need to be careful.
Well,
they can interact.
That they can
suggest
interact.
if anybody has any doubts about anything that they hear on this, or they're interested in trying it, please send us a message on Facebook or Twitter. The details will come up on the screen there. Please do contact us if you have any questions. Don't just go off and start taking stuff when you're not sure what you're doing.
And also, please remember that this is no substitute for professional medical advice. If you're unsure, go and see a qualified medical practitioner. So, in summary, back care, we want prevention. There are times when you can't prevent, where there is already an existing problem, but there's an awful lot that can be done, be it from the manual therapy such as osteopathy or chiropractic or physiotherapy, or from yoga in terms of prevention and also helping to keep things moving, from the naturopathic approach in terms of nutrition and other forms such as the magnetic therapy that we've seen, massage, kinesiology, so many other different approaches rather than just taking an anti-inflammatory. So from the Health Show for this week, thank you very much.
Thank you.
Thank you.
Goodbye.